Hi friends, today we are going to see NABH Standard 5th edition, 5th chapter, that is Hospital Infection Control, HIC chapter. The organization has a comprehensive and coordinated hospital infection prevention and control program aimed at reducing and eliminating risk to patient, visitors, providers of care and community. The organization provides adequate and appropriate resources for infection prevention and control. The organization implements the infection prevention and control program in clinical areas. The organization implements the infection prevention and control program in support services. The organization takes action to prevent healthcare associated infection in patients. The organization performs surveillance to capture and monitor infection prevention and control data. Infection prevention measures include sterilization and or infections of instruments, equipment and devices. The organization takes action to prevent or reduce healthcare associated infection in its staffs. Because all of these points are self-explanatory, I am not giving a big explanation. Let's move to the next point. The organization has a comprehensive and coordinated hospital infection prevention control program aimed at eliminating risk to patients, visitors, provider of the care and community. In that, they are talking about the hospital infection prevention and control program is documented, which aims at reducing risk healthcare associated infection in the hospital, which means you are having a documented policy and there is a policy and protocols to prevent infection. The Hospital Infection Prevention and Control Program identifies high-risk activities and has written guidance to prevent manage infections for these activities. So the high-risk activities, which means the invasive procedure, operations, and then ICU procedures, all those things you are identifying and having some policies to prevent infections during the procedure of those high-risk procedures. And the Infection Prevention Control Program is reviewed and updated at least once in a year. So NABH expect you to at least once in a year you have to review your infection control policy. The infection prevention and control program is reviewed based on infection control assessment tool. So there should be a tool. So based on that you are assessing your infection control policies. The organization has a multidisciplinary infection control committee which coordinates all infection prevention and control activities. So what they mean in multidisciplinary infection control committee, you will have a person from laboratory, radiology, medical team, housekeeping, biomedical. From each HOD will spare one linked person who will contribute as a multidisciplinary infection control committee. So altogether you will create a policies. The organization has an infection control team which coordinates the implementation of all infection prevention control activities. So there should be a infection control linked nurse, there should be an infection control manager and a spokesperson from all the department. The organization has designated infection control officer as part of the infection control team. There should be a specific designated person who will manage all infection control activities. The organization has a designated infection control nurse as part of the infection control team. The organization implements information, education and communication program for infection prevention and control activities for the community, and the organization participates in managing the community outbreaks. In case of any community outbreaks, the organization should actively participate. HIC 2. The organization provides adequate and appropriate resources for infection prevention and control. Again, it is self-explanatory. We should have adequate resources to provide infection control activities. The management make available resources required for the infection control program. The organization earmarks adequate funds from its annual budget in this regard. Adequate and appropriate personal protective equipment, soaps and disinfectants are available and used correctly. Adequate and appropriate facilities for hand hygiene in all patient care areas are accessible to healthcare providers, and isolation and barrier nursing facilities are available. HIC 3. The organization implements the infection prevention and control program in clinical areas. What do they mean? The organization adheres to the standard precautions at all time. The organization adheres to hand hygiene guidelines. The organization adheres to transmission based precaution. which is droplet, airborne, and contact precautions. And the organization adheres to safe injection and infusion practices. Appropriate antimicrobial usage policies established and documented as a policy. The organization implements the antimicrobial usage policy and monitors the rational use of antimicrobial agents. And the organization implements an antibiotic stewardship program. HIC 4. The organization implements the infection prevention and control programs in support services. What do they mean is the organization has appropriate engineering controls to prevent infections. The organization designs and implements a plan to reduce the risk of infection during construction and renovation. The organization adheres to the housekeeping procedures. Biomedical waste is handled appropriately and safely. The organization adheres to laundry and linen management process. The organization adheres to kitchen sanitation and food handling issues. HIC 5. The organization takes action to prevent healthcare associated infection in patients. So, in patient, what are we going to do? The organization takes action to prevent catheter associated urinary tract infection. The organization takes action to prevent infection related ventilator associated complication, VAP. And the organization takes action to prevent catheter linked bloodstream infection, that is CORTI. And the organization takes action to prevent surgical site infection, SSI. HIC 6. The organization performs surveillance to capture and monitor infection prevention and control data. The scope of surveillance incorporates tracking and analyzing of infection risk, rates, and trends. So, this infection control manager is going to incorporate the tracking, analysis, and infection risk, rates, and trends. Everything is monitored by the infection control manager. Verification of data is done regularly by infection control team. Surveillance is directed towards the identified high-risk activities, and surveillance include monitoring compliance with hand hygiene guidelines. Surveillance includes mechanism to capture the occurrence of multi-drug resistant organism and highly virulent infections. Surveillance includes monitoring the effectiveness of housekeeping services. Feedback regarding surveillance data is provided regularly to the appropriate healthcare provider. The organization identifies and takes appropriate action to control outbreaks of infection, and surveillance data is analyzed and appropriate corrective and preventive actions are taken. HIC 7. Infection prevention measures include sterilization and or disinfection of instruments, equipment, and devices. The organization provides adequate space and appropriate zoning for the sterilization activities like OT and CSST and ICOMC areas. Cleaning, packing, disinfection, and sterilization, storing, and the issue of items is done as per the written guidance. Reprocessing of single-use instruments, equipments, and devices are done as per written guidance. Regular validation tests for sterilizations are carried out and documented. The established recall procedure is implemented when a breakdown in sterilization system is identified. So throughout this chapter, D point, regular validation of test for sterilization is carried out and documented. Here we go this bio test and the autoclave machine test, all those things will come under this. And the established recall procedure, I think you all know. After supplying this central from the CSST department, if we are supplying any equipment and if we found to be broken or the package is already open where we suspect about the sterility, we have to do recall. HIC 8. The organization takes action to prevent or reduce healthcare associated infection in its staff. The organization implements occupational health and safety practices to reduce the risk of transmitting microorganisms among healthcare providers. This is to prevent cross-infection as well as infection to employees. The organization implements an immunization policy for its staff. So HR is responsible for this, and the organization implements work restriction for healthcare providers with transmissible infection, where you will control or restrict the staff. If they are affected with any communicable disease, they will not come for job. The organization implements measures for blood and blood fluid exposure prevention. The proper supply of personal protective equipment in lab and high risk areas, and appropriate post exposure prophylaxis is provided to all staff members concerned. Thank you.